Hello, my name is Adrian Moran. I'm a senior at Lyon College with a psych major and a pre-OT concentration, and this is my PechaKucha. For my presentation, I will be comparing two forms of treatment for children with autism spectrum disorders. These treatment options include pivotal response treatment and applied behavioral analysis. Both are commonly used in the treatment of children with autism. First, we need to define autism spectrum disorders. Autism spectrum disorders include a variety of developmental and behavioral disorders. The criteria for autism are first, problems with socializing and communicating, and second, repeated behaviors and very specific interests. These symptoms tend to appear at 2 to 3 years of age. As we said earlier, the first symptom of autism involves problems with socializing and communicating. So, children with autism often struggle to make friends and to communicate successfully with peers. Potentially due to these issues, children with autism tend to engage in fewer team sports and extracurricular activities. Another symptom of autism is a lack of ability in emotional processing. Children with autism often struggle to understand and manage their emotions. As a result, they can be aggressive toward themselves and others. These children also tend to express their anger with tantrums. Finally, children with autism often struggle to understand the emotions of others. So the goal of this project was to find a pivotal response treatment or applied behavior analysis was more effective at increasing quality of life, a numerical score that is measured with surveys. Quality of life in children is determined by testing their physical health, mental health, social success, academic success, sense of independence, and parent-child relationship quality. On average, children with autism spectrum disorders have lower quality of life scores than children who do not have autism. As far as quality of life assessments go, children with autism have lower scores in the mental health, social success, and physical health categories. Research indicates that this disparity is largely due to autism-related difficulties in socializing. So what is the next step? How can we increase quality of life for children with autism? Well, research tells us that the best way to increase quality of life for children with autism is to improve their social skills. Studies also indicate that the most effective therapies for children with autism increase helpful behaviors and decrease harmful behaviors. Our first option for treatment is applied behavioral analysis, or ABA. ABA teaches helpful behaviors by breaking them down into small parts and asking children to perform these small parts until they are easy. ABA can be used to teach new behaviors and offer alternatives to harmful behaviors. For example, it can improve communication in nonverbal children and decrease self-harm. The characteristics of ABA include therapy beginning at 3 to 4 years of age, requiring 20 to 40 hours of therapy a week, training parents to help, personalizing therapies for patients, including multiple patients and sessions, and using rewards and punishments, which often revolve around giving and taking tokens, which can be exchanged for favorite items. One example of ABA is the Picture Exchange Communication System. This technique involves a therapist giving their patient a set of picture cards, which feature items that are relevant to the child's life, such as their favorite toy or snack. If the child wants something, they give the therapist the card that features the desired item. The therapist will reward the child by providing the desired item. So what are the results of ABA? According to the available research, ABA does not significantly increase quality of life for children with autism. While ABA can have a positive influence on a child's mental functioning and language abilities, it is also known for inspiring escape-oriented behaviors, such as tantrums, self-harm, and aggression toward the therapist. Our second option for treatment is pivotal response treatment, or PRT. PRT is a naturalistic treatment that increases quality of life by improving pivotal areas of development. The pivotal areas of development in PRT include motivation, self-control, initiating social interaction, and responsiveness to therapist cues. The characteristics of PRT include therapy occurring in the home or school, therapy involving multiple children, play-based therapy that is controlled by what the child wants, clear instructions, and the use of natural rewards. Natural rewards are relevant to the child and include favorite foods, fun activities like listening to music, and favorite items like stickers. One example of pivotal response treatment is motivation therapy. In this method, a therapist will place a desirable item such as a toy or snack out of the child's reach but within their sight to encourage the child to ask the therapist for the item. By doing this, the therapist increases the child's motivation to communicate as a way of expressing themselves. So what are the results of pivotal response treatment? According to the available research, children with autism who received PRT experienced improvements in their social skills and communication abilities. The results of PRT also include improvements in a child's ability to participate in play styles that are appropriate for their age. While doing this research, I found a testimonial about pivotal response treatment. In this video, the mother of a young boy with autism praises PRT for its success with her son. She said that before PRT, when they were using ABA, they did not know what to do and they couldn't cope with the amount and severity of her son's tantrums. PRT gave their family a happier son and hope for the future. Along with its intended effects, research indicates that PRT can make improvements in unexpected areas. For example, children who received PRT demonstrated fewer undesirable behaviors such as tantrums and self-harm. PRT has also demonstrated an ability to help the parents of affected children, as parents of PRT patients experience less stress on average. PRT occurs in a child's natural environment and teaches life skills, meaning the lessons from PRT are useful daily. PRT only uses reinforcers, which are more effective than punishers. PRT is easier for patients because it is inexpensive and takes little time. PRT inspires motivation, encouraging participation and improvements. So why is PRT more effective than ABA? Like we talked about previously, research indicates that the treatments that focus on improving social skills are more effective at improving the quality of life of children with autism. PRT is therefore more effective than ABA at increasing quality of life because it has more success than ABA at improving social skills. As was previously mentioned, treatments that focus on increasing helpful behaviors and reducing harmful behaviors are more effective at improving the quality of life of children with autism. PRT is also more effective than ABA at increasing helpful behaviors and reducing harmful behaviors, meaning that it will have more success at improving quality of life. So these are my references. Thank you so much for listening.